46 years old. I'm still an active athlete, like to swim, bike, and run whenever I can. Had experienced some knee issues over the years with orthopedic knee surgery. It got progressively worse, my knee. I have stage 4 osteoarthritis in my left knee, so you have a lot of bone-on-bone issues. So it went from discomfort when exercising to simply discomfort when sleeping. It would wake me up in the middle of the night, just achy. Not a sharp pain per se, but it became a constant dull ache where you're taking more over-the-counter medications just to kind of get back to normal again. Have not found a solution or something that would help work and alleviate some of the pain and discomfort I'm experiencing when I exercise in my knees. Not a lot. I already had orthopedic surgery for a tear in my knee. The next was a replacement, which I wasn't quite ready for. I'm in that limbo stage of you're bad, but not bad enough. I checked with some different orthopedic surgeons about the options, but there wasn't really any place to go at this time until it got worse. I was a little nervous about what to expect on that. I hadn't done that before, but talking to Dr. Cassisi, I felt very comfortable in what was going to happen. I had 2 sessions done with that. The first session, you take about 6 or 8 weeks off from exercise. So of course you feel better then because you're not exercising. But I did feel noticeably better after the first session, and more so after I had a second follow-up session. Immediately I could sleep through the night better. I didn't have that ache as constant as before. I'm still leery of when I exercise, not as hard as I used to because I don't want to damage the effects yet, but I really do like the fact that I'm not being awoke in the middle of the night. It's easier to get in and out of the car, it's easier to go up and down steps. So that was a great relief for me not to have to swallow a bunch of pills every day and the Tylenols to get through my day, and now the PRP really helps me get functioning better every day. None at all. I scheduled my appointment late in the afternoon, was there an hour, was on a Friday, was back at work on Monday, and even was allowed to do things that weekend. So it's minimally invasive. There's no downtime per se at all. It's a fraction of the cost, and my only regret is it took so long to do it.
Back in 2006, I was involved in a hit-and-run automobile accident that left one disc torn. Put a cage in my back that was too big for my frame, and it pulled my spine backwards. I was forced to lie in a hospital bed for 3 years, and for an entire year, I was encased in a full body brace. Once a month, my husband has to drive me to the pain management doctor, and then it's bed to couch. There's no option that we did not look into. Acupuncture, physical therapy, obviously, which did not work, made my condition worse. Pain medication, no matter what they put me on, did not go anywhere near the pain. In my lower lumbar, where I have this titanium cage, the cage used to impinge on so many thousands and thousands of nerves. Oh, it was nothing short of a miracle. Well, within 5 days, I could not feel any pain around the titanium plate, but it also took away all the nerve damage from the left and the right hip areas. I mean, it was just totally gone. So then I was able to function more. PRP works. On the lower back, within 5 days, my low back pain was gone. A couple months later, Dr. K did my upper back. It's nothing short of amazing. Not nearly taking 1/4 of the pain medicine, and that's just pretty much for flare-ups. And probably because I'm actually doing more. Instead of just lying in bed all day, I used to get up at 3 or 4 in the afternoon. Absolutely, and call today. Call right now, don't wait. Call him right now, here's his number, which I carry with me. PRP has given me back my life, the life that I had prior to a horrific hit-and-run accident.
If you have persistent neck or back pain, remember, narcotics are addictive and surgery is irreversible. Call Sarasota Neurology now at 941-955-5858 for your consultation and evaluation for PRP therapy.